Today, I'm going to share with you 5 critical tips to help you crush your clinical placements in PT school and give you a whole lot of extra confidence along the way. So, let's get to it. Hello everyone out there in internet land. I hope you're doing well. If we haven't met before, my name is Jim. I'm a physical therapist and I'm someone who is extremely passionate about what it is that I do. And I'm also someone who is extremely passionate about helping other individuals become physical therapists themselves, regardless of whatever stage of their physical therapy school journey that they're at. And in addition to that, I'm also extremely passionate about just sharing all sorts of information with the world pertaining to physical therapy. So if you're someone who is curious about what physical therapy is, how it can benefit you, other unique things that I can do, be sure to hit the like and subscribe button so that you're getting all the content that I'm putting out. All right, with that being said, let's start talking about some of these tips. All right, we're talking about clinical placements. Now, before we talk about the actual tips, we just quickly want to talk about the fact that schools might do it a little bit differently from one school to the next in terms of when you're doing these clinicals throughout your schooling. Some schools are going to save all these clinicals right until the end, and then you just do them all at the tail end. Other schools might do it where you do some schooling, then you go away for a couple clinicals, come back for more schooling, and go away again. But these tips are universal, so it doesn't matter how your school is going to do these clinicals. Now, depending on how your school does it, it might change the expectations of what it is that you need to know for some of these clinicals as you go into a clinic. But don't get too hung up on that because these tips are going to kind of cover a lot of that information that I just talked about. So let's start with tip number 1. All right, tip number 1, regardless of whether you're anxious for your upcoming clinicals or you're confident, I want you to know and understand that your job heading into these clinicals is not to know everything. So take pressure off yourself if you think that's what your job is, because it's not. Your job is to show your clinical instructors, your CIs, that you are there to learn as much as you can and that you're interested in becoming the best physical therapist that you possibly can. That is your job. All right, so you got to remember that your clinical instructors know that you don't know everything. They know that you're a student. So take any pressure off yourself if you think that you have to go in there and know all sorts of stuff. Now, there's baseline levels of knowledge that you need to know, yes, but don't put so much pressure on yourself that you start questioning whether you know the things that you need to know or not. Chances are you already know them, and if not, as long as you're willing to work hard and put in the time and effort in your clinicals, you're going to learn whatever it is that you need to know. All right, tip number 2. Now, this is one of my favorite tips. It's way too common and way too easy for students to think that they don't have anything to offer when they go into the clinics. That is not true, because you need to remember, and this is the heart and soul of tip number 2 here, that you don't have to have 20 years of experience to show world-class care, compassion, and empathy for the individuals that you're working with and treating in the clinic. Again, people are going to blow you out of their water when it comes to their skills and their knowledge and their abilities, but you have the ability right now to show just as much care, compassion, and empathy for the patients in that clinic as they do. And you can even show more than they do. It doesn't matter what you know or don't know for school right now, because you can offer amazing empathy and care to your patients. And you're there for your patients. So I want you to keep that in mind when you're in your clinicals. Here's a great line that one of my professors told me when I was in PT school, and it really stuck with me, so I want to share it with you. People don't care about how much you know until they know about how much you care. So you can know all the things in the world, and that's cool, that's great, but if your patients don't feel like you're truly invested in them and that you want the best for them, it doesn't matter what you know. Now, I want you to also remember that if you're treating someone and you don't know the next step to take with the treatment, or again, what the next best option is for how you're going to work with this individual, that does not change how much care, compassion, and empathy you show for that person that you're with. Now, if you keep this in mind and you act it out and you carry it through all of your clinical placements, it's a win-win situation. The first part of that is that you're going to give better care and overall service to those individuals that you're treating and working with. They're going to thank you for just being compassionate to them and just showing that you're invested in them. The second thing that's going to happen is your clinical instructors are going to take note of that. They're going to say, hey, that patient that the student is looking after, the patient that came into my clinic, they're getting great service and they're being well looked after by the student here in my clinic. They're going to take note of that, and that's going to do some amazing things for you when it comes to either looking for employment with this facility afterwards or getting a great letter of reference from your clinical instructor. All right, tip number 3. we're going to piggyback off of tip number 2 into tip number 3. And tip number 3 is that you don't have to have 20 years of clinical practice and expertise to show world-class professionalism and work ethic. Now, when I talk about professionalism, I'm talking about characteristics and qualities such as being punctual, being dependable, showing respect for every individual in the clinic. Those are things that you just need to know to carry into your clinicals. It's important to remember your clinical instructors they know that you're a student. They're willing to teach you all sorts of things pertaining to physical therapy. That's why they're bringing you on board. But what they're not going to do is they're not going to teach you how to be professional because they shouldn't have to. That's something that you already know by now. You have those skills. Even if you don't know a thing about physical therapy, you can still show amazing professionalism in the clinic. And I don't want you to discount the power of being professional in every front possible when you're in those clinics, because doing that, again, is a great way to get your clinical instructors' attention, to let them know that you are just serious about being the best physical therapist you can possibly become. Now, the good news here is that your ability to be professional on these clinical rotations and for the rest of your PT career, it is not dictated by something like your GPA. It is not dictated by something like what you still have yet to learn in PT school. For what it's worth, I would contend that there is a direct correlation between how professional you act and carry yourself while you're in your clinical rotations and how likely you are to land the dream job that you want once you're graduated PT school, and how successful and how meaningful of a career you have from there on out. Tip number 4, I want you to understand that you will appear way smarter to your clinical instructors and to your coworkers and to your patients when you admit that you don't know the answer to something rather than just trying to BS your way through it. I personally believe that the smartest people out there are the ones who are willing to say the words, "I don't know," the most. Now, it's important for you to understand that just because you don't know something and you admit that, it doesn't mean that you stop there. If you do that, that's not going to look good at all. But what you need to do is you need to say, hey, I don't know the answer to that, but I'm willing to find out the answer, and I will find out the answer for you. Regardless of whether it's a CI or a patient, you're not expected to know everything. No one knows everything. You could practice for your whole entire lifetime. You're still going to have questions that you're going to get help from others about or have to look at resources to figure out. So don't even think for a second you have to know everything. Just be honest, be upfront, but say, hey, I'm willing to find that answer for you. It's important to remember your CIs are bringing you on board because they know you're a student. They want to help you learn. They want to help you grow. They want to do all that they can to develop you to the best extent possible. So don't think you have to know everything, but show them that you're hungry to learn. Again, you won't impress anyone when you try and BS your way through answers you don't know, but you will impress them when you show them that you're always hungry to find the best answer possible for that situation. All right, tip number 5, here is our last tip. It's important for you to understand that when you go out onto your clinical rotations, it's likely that you will get 1 or 2 rotations that you don't really enjoy that much. But here's what I want you to keep in mind. If that's the case, I want you to remember that how you conduct yourself and carry yourself through those clinical placements that you don't like, that's going to say way more about you than how you carry yourself through a clinical placement that you absolutely love. Again, if you get a clinical placement that you love, and all of them are clinical placements that you love, that's awesome. It doesn't happen to everyone. It does happen. But when you get a clinical placement you don't like, you need to remember it will not last forever. But ask yourself how you're going to carry yourself through that clinical placement, because you can get amazing growth professionally and even personally out of working through those types of situations and those types of placements. Here's a fun fact. The world is going to give you lousy days. Again, if you're in a clinic that you love, you still will have times where you're working with patients that are challenging or coworkers who are rubbing you the wrong way. It doesn't matter what type of job you're working, what profession you're in, what type of clinic you're in, that stuff happens. So using time where you're working on clinicals that you're not having a great time with and doing it with an attitude and a demeanor that says, hey, I'm going to get professional, personal growth out of this experience, that is going to do amazing things for you, not just for making that clinical rotation go quicker, but it's going to do amazing things for you when it comes to all other aspects of your life in general. So I want you to keep that tip in mind, because again, it is likely that you will get a placement that you're just not that wild about. Don't discount what you can get out of those situations. Remember, you know it won't last forever, so it's already a lot easier to get through it. It'd be a different story if you didn't know when that clinical placement was going to end. But you already know what the finish line is for that clinical placement, so now just dig deep and tell yourself that you're going to get personal growth out of that situation. All right, everyone, I'm hoping you got some great information out of those tips. And again, there are plenty of other great tips that people can learn about for their clinical rotations. So if you've gone through PT school or you've gone through your clinicals and you have some great tips you want to share, please leave them in the comments section below because you can really help out other students by doing that. Now remember, you're not expected to be an expert at your clinicals, but you are expected to work hard. You are expected to give your best efforts because again, this is not just a test of your knowledge up here, this is a test of what's in here. You can get through this, but you have to have the right attitude and mindset to do it. It's okay to be nervous and to be anxious. And if you are, I would just let your CIs know up front about that. Just let them know that you're going to give them your best efforts, but that you're a little bit nervous. They've been there before. They understand it. They get it. It's okay. Be honest, be upfront, and then just give it all that you got. All right, everyone, that's it for today's video. I hope you're doing well. If you're on clinical placements right now, or you're getting ready to go into your placements, I'm wishing you the best of luck. I know that you can do great things. So breathe deep, grind hard, and remember, you got this. I'll see you in the next video.